are a woman, I'm sure you have had questions about your health, more specifically, hormonal health. How can you have a more sustainable period? What are fibroids? Should you have kids? When? Which birth control is best for you? Why are menstrual products not free in public toilets? These and many questions. Menstruation is a natural and vital aspect of reproductive health. It often bears misconceptions and taboos. Addressing this, Love Your Menses, a Boston based 501(c)(3) organization founded in 2019 by Dr. Azumah, champions menstrual equity through education, dispelling myths, and fostering supportive communities for individuals to thrive in their reproductive journey. Welcome to the podcast, Dr. Azumah.
Thank you so much, Tej, for having me here. An excellent preview to our conversation. I love how you phrased it. It's so beautifully phrased. Thank you.
Thank you. So, what inspired you to co found Love Your Menses in 2019? Was there a reason? Was there a trigger, incident?
Great question. So in 2019, at that time, I had taken time off from practicing as a OBGYN, obstetrician and gynecologist, to go study public health. And the reason why I went to study public health was a burning question. At the time, I was working in Washington, D.C., and they closed down the hospital, at least the department that I was working at. And I couldn't understand why such a vibrant um, department would close down. I really loved
Hmm.
who I was working with. I thought I was going to retire there. I loved the patients we served. We were serving
Hmm.
mostly the Hispanic population and the indigenous people of Washington, D.C. So once it was closed, I said, I need to understand public health. I need to understand health management. So I got admitted into Harvard's T.H. Chan School of Public Health. So I went there and then I realized that there's so much related to providing health and providing care. One of them was social determinant of health, which affects health. As a physician at the time, I focused more on the clinical part, the
Hmm.
pathophysiology of health,
Hmm.
not focusing on the social determinant part, right? So when I went, I was interested in more education, community education. That's how I met my partner. And my partner was so interested in menstrual health. And I saw the need for that because as a gynecologist, everything starts with menstruation. Like when you're
Yeah,
pregnant, we use everything is menstruation, right? So
absolutely.
so we felt like menstruation was key. Menstruation was key not just for clinical health, but menstruation was key for even mental health, right? Because we see that our black and brown youths were struggling with their mental health. So we felt if we use this menstruation that focuses on physical health, it also
Hmm.
helps mentally. We basically have covered the entire tenant of a girl child, of a woman.
Hmm.
So that's why we
Hmm.
really started it. And when we started it, we started learning so much about period poverty, menstrual equity, and it just kept expanding. And now, we've influenced policies and we have more people talking about period poverty and menstrual health. So that's just it's just beautiful how we got involved and how we became one of the spokespeople advocates for menstrual health. So,
Wonderful, wonderful. So, why do you think there is still a stigma about menstrual health? Do you feel that it is still there?
yes, it is. And to be transparent, it's within women. Um,
Hmm.
a lot of women don't understand it. There's shame with menstruation. There's shame. When we go teach right now, we're doing a workshop with in the Boston Public Library in
Hmm.
collaboration. The leader is the Mayor's Office of Women's Advancement. And when we
Okay.
have someone come in, immigrant woman, specifically this Hispanic lady, she was so nervous that her child would soon start menarche, which is the first stage of menstruation. She was
Right.
sad because she knows that her daughter might start her menstruation at age 10, and she wonders, is
Oh,
her child ready? Because they equate menstruation to being able to be pregnant, which is
right.
accurate, but it's really not. It's when we think about women's health, there's so many controversies unnecessarily, cultural
Mm-hmm.
taboos associated with it. For example, sorry to divert from the conversation, but when we think of menopause, which we started teaching, people think is the end of being a woman. Those are not, like, the physiological parts of women are just phases of life. They don't devalue who a woman is or who a girl
Right.
is. So we just have to help the community. It's called change management. See things or question habits or question beliefs even within women. I love your menses because we have many men involved in our organization, and these men are champions. Um, and when I talk to people, including menopause, men are like, I wish I understood menopause, because when I'm at work, a lady's like fanning herself, like, ooh, they're like, what is going on? They don't even know what it means, but they want to know so that they can help. I really, I really think that there are stereotypes because of miseducation. When
Very
we
true.
talked to the lady, we told her what menstruation is. She felt better. We said, yes, your child can get pregnant, but you can have a conversation, right? You can have a
Right.
conversation, educate your child what it means to have safe sex or abstinence, whatever you want. Just have a conversation. Ignoring things is really not a bliss.
Very true. And how does Love Your Menses, your organization, work towards dispelling these myths? Of course, you are going to the library and talking to people there, but otherwise, do you have other ways of creating awareness?
Yes, we do. We do. A lot of people on our team are highly intelligent people, like extremely intelligent people. I don't know if you got the chance to review our board, but we have people with
I
a
did.
doctorate in public health that are
Yes.
award winning epidemiologist, researcher. We have a PhD in behavioral sciences. We have a
Yeah.
pediatrician. We have a long term OB nurse. We have an internist. We have a media journalist that is on all about civil rights. So we have just a plethora of people just on the board. The board
Yeah, the right
in
people.
nonprofit, yeah, the board in nonprofit basically are the ones, they're the key stakeholders in the organization. So anytime we have any concern or problem, we go to them. So because of this plethora of people, we have many avenues of reaching out to the community. The Boston Library is just one arm, as you said, but we use our social media. We have a monthly webinar. Like this month on the 29th, we're going to be talking about neurodivergence, right? And how
Okay.
to teach parents that have kids with autism how to like navigate the system. So we are always using all the skill sets that we have to teach. So we have the webinar. I've even written a book, a children's book on menstruation called Maya Lens About Menstruation. We intentionally advocate for diversity in social media. So most of our images reflect the population we primarily serve. We don't just serve black or brown people, we serve
Everybody.
everybody. But our main clientele are those people that need that
That need.
support, that need that knowledge, because we see data shows that black youths don't have as much education as their counterparts. So it's our duty to help close that gap. So it's just plenty. We have plenty of avenues, and we're very grateful for the mayor's office in Boston for reaching out to us and giving us the opportunity to showcase what we do. So we're very grateful.
Right. Wonderful. So, uh, you collaborate with other entities and partners to further your mission. But is there any way that you require help in terms of volunteers? Is it virtual or in person?
Great questions. Yes, we do have volunteers, such as students doing their practicum. For example, we have a student, Laura. She's doing her practicum with George Washington University. She's a master's student. We also have Joanne Cisse. She's also doing her practicum with us. She's also a part of public health with George Washington University. Then we have volunteers like Anne Laurie, who wants to be a future gynecologist, but she loves menstrual health. So she volunteers with us as well. She's a student from Howard University. We also have high school students from around Boston that also volunteer. People that love the work we do call us, and we appreciate our volunteers because it takes a lot of work. We have a high need to meet the needs of the community. For example, we provide menstrual pads to public facilities. So we've provided pads to Boston Public Police Office. We've provided pads to churches. So we need help even distributing that. So we thank our volunteers. Our volunteers can volunteer in person or virtually. For example, Laura
Nice.
will be doing mostly virtually because she's based in California. Her master's degree is through the online program. So we have that. We have people like Joanne Cisse that volunteers in person. For example, she was in Sarah's house this Wednesday when she was donating. Our, she donated about 250 tampons, 300 pads to the women in the shelter. I mean, whatever we can do to support women
Right.
is what we love to do. Hmm.
Right. So, do you think that public utilities should have, pads and tampons? Because across the world, nowhere will you find free tampons. You do have vending machines, but most of the times, when it is an emergency, people will not necessarily have the change or, the resources to get a pad. So, do you think that sanitary pads and tampons should be made available? And if yes, then how should this issue be tackled?
Awesome. Very great question. Thank you, Taj, for raising them. Definitely, we believe that if we have more public facilities providing pads, then Love Your Menses will not need to provide pads because each day we work hard to get grants or donations. We're always thinking about what happens if our supply finishes. Like, how can we support the charitable houses, the churches, right? But if the government, if the world provides pads, then that will not be our problem, right? But you know what? It's a problem that we love to fix, and we've done that. Like we're in 7 other countries, so we try to do period parties, we try to do product distribution. We work so hard to make sure it happens. We've seen my partner in Kenya, James Gattari, just sent me a data showing that wherever there's menstrual equity, there's lower teen pregnancy rate.
Yes.
Like, it was just beautiful the work he's doing in Kenya with our support, partnership, and mentorship. So I know in Kenya or even the Western African world, if we have free pads, it'll be amazing. Girls can go to school without shame. Girls will not need to exchange, right? Transactional exchange sex for pads. It will be
Yeah.
great. It will be great. The world needs that. However, let me go back to my backyard, which is the United States. There are many, many policies and laws being enacted to ensure that pads are available in the public places because one, it will help the kids, especially first generation college student that has to decide, do I need to buy food or pay for pads, right? Not everybody, there's some people that are wealthy enough, God bless them, that they can pay for the pads, but there's some people that have to make a decision between eating healthy, like healthy food, versus buying pads. Like we always say, pad is not a necessity. It's it's not
It
something like
isn't.
a streaming device that you have to spend $10 for per month. This is a necessity. So we definitely encourage that there should be free pads all over, especially in the United States. We're so proud of the State House of Massachusetts for passing the I am bill that will allow for there to be pads in the public area. We're hoping that the House in Massachusetts will do the same thing. So there are multiple policies around the country. We see that in New York. We see that in many states. We see that in Missouri. We see that in many states that's trying to change it. And we hope that in the next 5, 10 years, there'll be pads everywhere. That'll be awesome.
Yes, I love the way you are passionate about this project or this initiative. Now, to have your team work with the same dedication, the same passion throughout, can be challenging at times, isn't it? I know passion goes a long way, but how do you stay motivated?
Um, you know, you, when I went to public health school, I did my medical education in Wayne State, and I love my school. I'm a proud alumni. But there's something about people with public health passion. They're so driven to change the community. And I have to say, the people on my team are extremely driven. Are we fortunate? Maybe. But they are like, they're amazing. Like, I mean, recently, Huntington News, which is a news organization under Northeastern University, interviewed many of our staff randomly, and they were all passionate. They were all passionate about the work we do. So we just happen to be lucky that they have the same drive as me. It doesn't matter if they're older men, younger men, they have the same drive. It's
Yeah,
really fascinating because they work for nothing. I work for nothing
true. Yeah,
compared to what my salary could be as a physician. But we are driven that we can be that change
you want to,
that the
yes, you want to
community
make a,
needs. Like we
yes,
don't think that we should rely on others. We are they persons to motivate the change. So
right.
my team, I have to say, they're mission driven. Like mission driven. I don't know if we're selective on who we bring into the team, but I have to say almost unapologetically, because we use their term, that 99% of us are driven to like help the community. I don't know how, but we all are.
But you, yeah, so birds of a feather flock together. It's like that, right? So you attract the
Yes.
right people. I think that's how it comes. Let's take a break to understand what Chezuba is. Everyone at some point ponders on how this beautiful life can be made more meaningful. Maybe you're a leader trying to enhance your employees' experience at your organization. Or you already work for the community and seek volunteers with state of the art skills to strengthen your nonprofit. Whatever your situation, know that you can make a difference. Chezuba began with this very vision, a vision to facilitate every skill and every passion in the world in meeting a social need. Corporate volunteering has several benefits for both businesses and organizations. In parallel, experienced and enthusiastic volunteers join NGO workers, enabling them to serve the community more effectively. Chezuba offers everyone looking to add purpose and meaning to their lives a chance to connect or volunteer virtually with nonprofit organizations from over 100 countries around the world. Visit www.chezuba.net and explore opportunities to find meaning. Chezuba, your platform to do good. And now, back with our guest. That's
I mean,
wonderful,
it's
wonderful.
amazing. It really is because people come and say, "How you guys have all this money to do this?" We're like, "It's not money. It's just a group of people with
Wanting to do
talent."
something.
Yeah, yeah, wanting to do
Yes.
something. Everybody. It's pretty. Like I will share the link to the article because they interviewed Bryston, they interviewed Dancer, they interviewed Yatunde, and they all were mission driven. Like I wasn't there, I wasn't
Amazing.
present, and they are like it's amazing. It's really I'm
Lovely.
very grateful.
Wonderful. So tell me, what does Love Your Menses look forward to in the next 3 years?
Wow, in the next 3 years, we want to, we hope that more states in the United States will make
Okay.
period products available in public areas. We hope that more people will love their menses. We hope that more countries will join the movement. We hope we have the financial ability to continue to expand because we have requests almost frequently, I'll say monthly, different countries wanting to join us, but we have to tell them, hold off, we can't, not now, because it takes money to provide these period
Yes.
products, period parties, or education that we provide. So we tell them not yet, but we have a waiting list. Whenever we have extra income, then we can expand. So maybe in the next 3 years, our organization will have the resources to expand so that we can go everywhere teaching people how to love their menses, how to love themselves, how to love their community, and how to be our neighbor's keeper. Mhm.
Sure. So, a couple months ago, I interviewed a young girl from Tanzania, and she was into making of cloth sanitary pads, reusable sanitary pads. Is there something like that that you are also thinking of, around?
Awesome. Thank you, Tej, for asking that. So we have a partnership in Sao Tome and Principe, and our partners there do not use disposable pads. They use only reusable pads. So in that community, that's all we do. We have our partners in Uganda that also produces reusable pads. So we are working to expand that so that they can produce more pads that we can distribute. So that's definitely in the works. One
Right.
thing that I love about our organization is when we partner with communities outside the United States, we ask them, what are your needs? What are your principles? What do you want? And then we work with them to build whatever they have. And then we suggest and coach them on how to do them better. For example, when we went to Sao Tome, they were very, very clear that they want only reusable pads because of the environment and the
Exactly,
ability to
yes.
break down disposable. So that's one. Another one that we're working on is the menstrual cup. We're working on a partnership with another organization to get discounted cups and see if we can introduce them to some other countries to see what they how they would feel. So we want to work on a research project using our communities internationally to see if the introduction of reusable products will be well accepted. We had a conversation in Nigeria and said, would you be interested in using reusable pads versus disposable pads? And they had some limitations, right? For you to do that, you have to have enough water and soap. Not every place
True,
has that.
true,
So
true.
it's really, really cool to, as you know, as an organization, to look at people's needs and if it's feasible, the feasibility of implementing change. So it's
Very
interesting,
true.
but that's one thing that we're really working hard on. We want girls and women to have options. So that's why we
Right.
try to teach them everything. So yes, we teach them. We're working on it. Again, everything depends on financial resources as well.
Very true. And also the
Yeah.
circumstances. Not every place, like you said, has resources to facilitate those kind of products. Indeed. Yes.
Yes,
Thank
ma'am.
you, Dr. Azuma. It was lovely and I would say liberating talking to you.
Thank you so much, Taj. Thank you so much for inviting us over. We look forward to coming back again. Thank you for the work you do, your organization. I'm so grateful and proud of others that believe that the change begins with them. So thank you.
Lovely. Glad to have had you on this podcast.
Thank you.
Embarking on a journey of empowerment, menstrual health and awareness shine as crucial facets of well being. In a world where taboos often shroud this natural cycle, initiatives like Love Your Menses illuminate the path towards understanding, support, and education. I'm Tej, signing off on today's episode of Chezuba Talks.